So welcome back. What I'd like to talk about now is public health and prevention in the Affordable Care Act. So you may recall from our second lecture that we gave you an outline of what is in the ACA. And you may recall that Title IV of the ACA is all about public health and prevention. So what are the key things that are in there that deal with this important issue? So number one is there's the establishment of a National Prevention Council that formulated a national prevention strategy that was released in June 2011. It's a wonderful example of something I'll mention a little later called Health in All Policies. It was a Health in All Policies approach to think about how can we create a healthier American public in all parts of the nation. If you Google National Prevention Strategy, you can get it brought up right away. I'm disappointed there hasn't been more attention paid to it since it came out because it's a landmark and important document. Connected with the strategy and the council is a Prevention and Public Health Fund that was established again in Title IV that had a dedicated fund of about $15 billion over 5 years to invest in new public health initiatives, including the creation of something called community transformation grants. Some of that money was pulled back in some of the budget deals in Congress, but there's still a robust infrastructure in place to advance public health, and these funds have been important in terms of the tight fiscal times that we've been in over the past few years. Something else in the ACA around prevention and public health is, and you may know this or you may not, but beginning in 2010, all health insurance policies in the United States, in Medicare and private health insurance, have to provide to enrollees access to evidence-based clinical preventive services with zero cost sharing. What are clinical preventive services? Well, you may have heard of mammographies, you may have heard of prostate cancer screening, you may have heard of tobacco counseling. There's a host of them now, and who decides what's proven and what's not? There's an organization that's part of the federal government called the U.S. Preventive Services Task Force. It's made up entirely of non-federal employees. Almost all of them are physicians, primary care physicians, and a couple of other epidemiologists and experts. And they look at the evidence for every clinical preventive service. If the evidence is strong that it works, and they don't consider cost, by the way, in terms of whether it works or not, but if the evidence is strong, it gets a grade of A. If the evidence is divided, but it leans in the direction that this really works in terms of helping people, it gets a B. If they can't really judge from the evidence, it gets a C. If the evidence shows that it really doesn't work, it gets a D. So everything that's graded as an A or a B must be provided in every health insurance policy in the United States under the ACA with no cost sharing. Another element in the ACA, beginning in 2014, later this year, we expect all chain restaurants with at least 20 outlets will have to label on all their menus, menu boards, and drive-through menu boards the calories, the number of calories for every item. I'll talk a little bit more of that in a minute. Another item that is somewhat controversial is an ability for employers to vary health insurance premiums by as much as 30% based on participation in wellness activities. And there's been a lot of regulatory work to define when they can do that and under what circumstances. And some people are worried about this, other people think it's terrific. So a lot of division in terms of this, but it's something that's very much a part of the law and a lot of employers are paying close attention to. Let's just look a little closer at two of these items. One is calorie labeling on chain restaurant menus. The Food and Drug Administration is in charge of implementing this. The statute, the ACA, says it applies to any restaurant chain that has at least 20 locations. So McDonald's, Burger King, Subway, all of them will have it. In the regulations, the administration decided to exempt movie theaters, airplanes, bowling alleys, for example, as not being required to do it. There's a proposed 2,000 calorie diet is the standard and the basis for nutritional advice, although individual needs will vary. And it has to be prominent. You can see on the illustration on the right that to the left of each item are the number of calories that are there. And it's been interesting from a political perspective because there have been, these regulations have been delayed in coming out, and partly because there have been so many controversies. For example, when you identify the number of calories in a pizza, do you do it for the whole pie or for a slice? If you're the pizza industry, you just want it for a slice. You don't want to have to label the whole calories for the whole pie. Big fights about that. Supermarkets are trying to get themselves exempted for their salad bars and things like that. So lots of controversy about it. The statute establishes a standard, and then it's up to the agency to implement the policy and define it in ways that the people who wrote the statute never imagined. So this is just one example of the many ways that the ACA is impacting how we live and how we try to keep ourselves healthy by giving people information. So this is a great example of transparency in terms of trying to influence in some way Americans' eating habits.